Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. Tonight is part 2 of a special 2-part series on artificial intelligence at St. Luke's University Health Network. We're joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now.
Coming up on this episode of Health Now, an in-depth look at artificial intelligence at St. Luke's University Health Network. Stay tuned.
Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Let's meet them again. Up first, we have Charles Sunday. As Director of Medical Informatics, Charlie leads initiatives in artificial intelligence and provides functional leadership and day-to-day support for the use of information technology in patient care areas. He ensures that functional requirements are met in the design, implementation, and ongoing use of artificial intelligence initiatives and clinical information technology. He holds a doctoral degree in advanced practice nursing with national board certification as an acute care, critical care nurse practitioner, and undergraduate degrees in nursing, engineering, and math sciences. He has been a member of the St. Luke's clinical community for 24 years in various clinical leadership roles. Thanks for being here, Charlie.
Thank you.
So we talked before a little bit about informatics in the first part of this series. Tell us a little bit about informatics and the people behind the scenes that are working in this field to provide patient care.
Sure. So we have a group of clinical informatic nurses led by Jen Grell, our Director of Clinical Informatics. They work to really discover the data behind the different initiatives that we're trying to predict using artificial intelligence. They work directly with me on the different initiatives around artificial intelligence, so they help bring the algorithms to the bedside. They really work with our nursing staff, our physicians, our other clinical staff that may be receiving the messages from our artificial intelligence and our automated alerts from those algorithms to make sure that they're meaningful, that they're able to be interpreted by clinicians, and that it's really meeting the metric that we're trying to achieve.
So the informatics team is really the bridge between the AI and the bedside.
Absolutely.
Great, thanks, Charlie. Let's meet our second panelist, Chad Brizendine. Chad serves as the Vice President and Chief Information Officer at St. Luke's University Health Network. He joined St. Luke's in 2009 after serving as the Corporate Director of New Technology and Delivery for Christus Health in Texas. He has over 17 years of experience in healthcare information technology operations, disaster recovery, business data management, innovation in health IT, and IT strategy and IT governance. He specializes in transformational healthcare projects, including EMR, healthcare connectivity, data management, and business strategy. Chad has worked with over 80 EHRs and connectivity platforms across a variety of community settings and has successfully integrated data in and across the health community. Thanks for being here, Chad.
Thanks for having me.
Why is information technology or the IT department so critical in healthcare? What does it really do?
Well, we have about 20,000 employees roughly at St. Luke's, but we have 60,000 pieces of equipment that have software on there. So about 3 times as much software out there as we actually have people. And each department has their own set of systems, whether that's computers, other devices that they have in their department, and each of those run software. And the IT department's job is to help, support those systems as well as help bring new software to fruition that might help solve problems for those departments.
So in a lot of ways, becoming the backbone of healthcare and of all business.
Correct.
All right, in part 1, we established what electronic medical records are as well as algorithms. I'd like to talk about that briefly again. So I'll start with you, Charlie. What is an algorithm and what role does it play in AI?
So an algorithm is really a complex mathematical equation that takes in pieces of data and information, scores it, and then presents an output. That output is then delivered to clinicians, nurses, doctors, anyone who's on the front line of different patient care services in a digestible format that they can understand. So it's really, the algorithm is taking large data sets and taking it, collating it down to so that the human brain can understand that.
And Chad, what about electronic medical records? You've done a lot of work around those and their development. What are they and how do they help patients?
Yeah, so basically electronic medical record stores all your information as a patient, and its job is to basically provide that information back to physicians, but also back to patients, that if you get a result from something, that information comes back to you and you understand what may be impacting your care as a patient.
Great. Well, thank you both for giving us a little background on artificial intelligence and electronic medical records, as well as algorithms. I think it's so important to our discussion. So now we're going to explore the data and the team at St. Luke's and how they're working together to improve patient care. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Membership in the Children's Hospital Association can benefit everyone who's caring for children.
We have access to resources that we might not otherwise have.
Each floor is uniquely themed and interactive for kids to be comfortable in a setting that can sometimes be anxiety-provoking when you're outside of your home.
First and foremost, children are our future. So if we want a healthier tomorrow, if we want a healthier generation going forward, it starts right now.
My main oversight is to assure that our patients get the highest quality and safest care that they can. AI is very effective in helping us identify patients who are at risk for certain complications. Electronic medical record is really just a repository of patient information. It includes past medical history, current diagnoses, as well as their vital signs, any results of tests or procedures that have been done for the patient. We're also using it to detect and help us better detect cancers and to treat cancers. So in the case of radiation therapy, AI is used to take the characteristics of a patient's tumor and are better able to target the treatment of radiation therapy to that tumor, having better outcomes and minimizing the risk to surrounding normal tissue in the patient. What it does is it is an adjunctive to helping our clinicians take better care of our patients. We wouldn't be able to identify patients at early stages of deterioration without this. What it does for our providers is it helps them feel even better about the care that they provide to patients. This is really, really exciting because the work we've done so far has had such a dramatic impact.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching part one of our program and providing questions for our panelists, which we'll get to later in this show. Joining me tonight is a talented panel of professionals, Charlie Sunday and Chad Brizendine. We've learned about your expertise, but now we want to dig a little deeper in how artificial intelligence is improving patient care at St. Luke's University Health Network. Charlie, I'll start with you. You told us previously that one of the early adopters of algorithms and data analytics is breast health, so mammograms. Can you expand on that and how the analytics are being used to help women with the outcomes of breast health?
Sure. So the algorithms that exist inside of those radiology tools really identify sooner abnormalities in women's breast tissue. That abnormality then can be further investigated, whether it's a biopsy or it's another radiology study that might be more pertinent to that finding. But the goal is really to identify sooner any abnormalities so that treatment can begin.
And you know, Chad, when Charlie's talking about these different analytics, how does the IT department work with the medical staff to ensure that AI and data are being used correctly? Because I would imagine that it's a lot to learn and layer on top of your medical knowledge.
Yeah, I would say most of the work in AI is in data preparation and data analysis. And that's where a lot of the work is done. So once we bring the data in, really having people look at the algorithm to make sure that it's operating properly, that the data underneath it is accurate, that it's precise, and then when it provides the score back, that people believe it, they understand how it was calculated, and they'll use it to take action on it, and that's really where the IT department spends a lot of their work in the artificial intelligence work.
It's incredible what's going on behind the scenes with technology, but Charlie, all of this means that medical providers need to know not only about medicine, but they also need to know about computers and how to interpret data. So what does the future training of providers look like in order to integrate medical knowledge and AI?
Yeah, so I think that future is already here. Most of the programs, whether it's a physician program, a nurse practitioner program, a PA program, nursing programs, incorporate informatics. Basic informatics, the basic understanding of data, medical data, and how it translates to the EMR and how you interact with that medical data. The future is really helping clinicians understand what Chad talked about, is how the data gets cleaned, how to trust that data, and how that data gets leveraged to provide those insights for your patients.
There are so many ways that this is impacting patient care. And Chad, I want to ask you, because in part one, Charlie talked a little bit about sepsis, and just this episode we're talking about breast health. What are some other areas that we could practically see AI helping treatment options and patient outcomes? Things like oncology and other areas. Where are we seeing this help?
Yeah, I mean, definitely in the oncology space, we're already seeing that with some of our protocol management. But what I would say is go back to some of the challenges we have with the electronic medical record, which is all about, it takes physicians more time to interact sometimes with the electronic medical record than what we'd like. And so as a patient, when you walk in, you might see your physician keyboarding or documenting inside the electronic medical record. And we're working on voice technology that would change that out. So as a patient, when you walk in, it's listening to what's going on, and it's reducing the time that it requires for that physician. And that's all AI driven. So it makes the patient to physician interaction better, but more importantly, it decreases time for physicians to have to do manual documentation.
When you talk about something listening in, we're sort of getting used to the concept that our phones are listening to us, but thinking about something listening into a medical appointment, what are some of the concerns that you might hear, Charlie, from patients around that, and how does St. Luke's mitigate those concerns?
So I think the concerns would really be, hey, this is my private health information. Where is this going? You're listening into this conversation that I'm having with my physician. Who else can hear this conversation downstream? So St. Luke's works very hard to protect patients' data. I'm going to have Chad discuss that because he manages the security and IT for St. Luke's.
St. Luke's uses best practices that are industry standard for all healthcare, and we meet the mark or exceed the mark in all of those best practices. We take extreme rigor on our patient's medical record, and basically that's everything from prevention to detection to predictive analysis to determine who might be coming at us to get that information. And so we look at basically all threat detectors for our security to determine the likelihood of impact. For the last 4 years, St. Luke's has been working in security with Microsoft, which has invested tremendous in the healthcare security space. And we have been an early adopter of many of the new security platforms that are making our patient information more secure. But I think going back to the use case where we were talking about patients' interaction, and that voice record is actually transcribed directly into your electronic medical record, so it's part of the overall security of your electronic medical record.
So even though people have seen doctors writing on paper for years and they have a comfort level with that, in some ways I would imagine that that is at more risk than something being electronic. Is that true?
Well, I think you could easily see that, it used to happen where a car got stolen and all of a sudden medical records got stolen, or someone broke into a practice and got, somebody's medical record information, or somebody had the medical record and it got lost. And now we know and we can determine who had access to that record, how it was reviewed, and making sure that not only did the right person view it, but that it was protected when it was viewed.
It's great for patients to know that their medical records are so secure. Thank you for that. But we're not done yet. After the break, we'll learn more about the future of this technology at St. Luke's. You're watching Health Now. Stay tuned.
What do you get when two visionary organizations with similar missions for caring for patients with mental and behavioral health issues decide to come together? Well, a partnership combining 210 years of award-winning health experience that will enhance our shared commitment to our community's mental health status. broaden the educational programming and services we deliver to patients and families in need, and improve patients' access to mental and behavioral health care. It's a growing geographical footprint featuring more inpatient and outpatient services, creating the largest fully integrated network of mental and behavioral health services in eastern Pennsylvania and New Jersey. United in mission and service. We are St. Luke's Penn Foundation.
My name is Aldo Carmona. I'm the Senior Vice President for Clinical Integration and the Chairman of the Department of Anesthesia and Critical Care. Clinical integration simply is getting our resources together to create better outcomes for patients. And that can involve care redesign, that can involve new programs, that can involve technology. So artificial intelligence is allowing technology to do things that human beings can find very difficult to do. For example, look at multiple data points at the same time. During the pandemic, St. Luke's was the first hospital in the nation to get real-time vital signs integrated into our electronic health record, which is Epic. And vital signs are called vital for a reason because they're often the first harbingers of change when patients' conditions are changing. Early treatment and effective treatment saves lives. St. Luke's is probably at the forefront of that technology, and we're really well positioned to take advantage of those changes as they happen because we have a lot of the base technology here already. And I think that's the difference that the network has in our great outcomes, is that we're able to do those things. There's a great team of people here that make that happen. That to me is the biggest reward, is to say, can we create processes and can we use technology wisely, and can we help our staff to not just take care of one patient, but to have that system go in place that just keeps improving to keep getting outcomes better long after I'm gone.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about artificial intelligence at St. Luke's University Health Network. In case you're just tuning in, I'm joined by two St. Luke's professionals, Charlie Sunday and Chad Brizendine. Thank you both for being here. In the first part of the program, we talked about artificial intelligence and the technology available to the medical staff, how algorithms are being used, how data is being collected and used for good patient care. I want to dive a little bit deeper into this, and Charlie, I'm going to start with you. There are untethered medical devices being used that are collecting data. Can you tell us what an untethered medical device is and the data it collects?
Sure. So every patient that comes into our healthcare system has a device that will go on their arm that will monitor their blood pressure, their heart rate, their respiratory rate, and their oxygen saturation. That data communicates wirelessly with our EMR, and then that information that's entered wirelessly right from the patient's arm goes into the algorithms that we talked about to predict early onset of sepsis, to predict early deterioration, to predict someone who's at a high risk for readmission. So when we look at that data that's coming right from the patient's arm and the data that's being entered by nurses, physicians, and lab is all mixing together in that algorithm to provide a risk. So if we think about deterioration index risk, continuously that data is being fed into that algorithm as that patient's journey happens across the healthcare setting. And that data informs the provider of what that patient's risk is of having a transfer to the ICU, so that the provider or the nurse can interact quickly through the use of alerts that are messaged out to our secure messaging platform.
So lots of times you're waiting for a physical exam or someone to come into the room, and I think what you're telling us is that with AI, you're able to monitor a patient continuously and maybe predict something before it happens.
Correct. It's like eye in the sky for your patient.
Excellent. What about remote monitoring, Chad? Are you able to have monitoring happening from remote locations of people who are critically care in the hospital?
Yeah, so we're able to today take certain devices home with you, and then based on that, our clinical team continue to monitor that, and that information comes back in and it can predict what may be an escalated score for you, and then we need to take action on that score. So that can happen today. And additionally, in the future, near future, we can do disease progression so that we can look at things like diabetes, CHF, and COPD.
Wow, that's really incredible. What about someone who has a variety of interactions? So perhaps it's with your primary care physician, and then perhaps you had something happen that required a short hospital stay, and then perhaps you needed the visiting nurse association, or you have daily monitoring for your diabetes. Do all of those things speak to one another, Charlie? And how do you monitor this data at home?
They do. So all of that data, again, is going into that repository that's the EMR. So any data that's put in by visiting nursing or your primary care physician is entering the EMR and contributing to that algorithm to use for that metric that we want to monitor. So if it's diabetes, Chad talked a little bit about diabetes, if your blood sugar is being put in through your MyChart account, that's a piece of data that could go into that algorithm. If a visiting nurse puts in a diabetic foot exam, that's a piece of data that can go into that algorithm. That algorithm takes all those different data points across different time periods and comes up with a score for disease progression. And that can be seen whether that patient's in the inpatient setting, they're in the ambulatory setting, and they're going to have a visit with their PCP, or if that visiting nurse sees them for a home visit, they can see that risk of progression for disease.
St. Luke's really provides incredible personalized care, and people have relationships with their providers, and that's really important, I believe, to the network and to all of the patients out there. What happens with personalized medicine in this new age of AI and technology? And I'll ask that to both of you.
Personalized medicine for me is all about providing a more direct care to you based on information that we have. So in the area of cancer, for example, DNA sequencing is being used because we want to be able to determine what potential pharmacology may be used to better prescribe certain medications or regimented treatment to you so that we can take care of your cancer.
So based on the genetics of that patient, that information is put into an algorithm or put into the EMR, and it is leveraged right as the physician is prescribing a medication. So the algorithm will say, you've prescribed X medication, but based on this patient's genetics, the best medication is Y. And that patient can then have a discussion with their provider about the new treatment algorithm that's been leveraged through their genetic information.
So truly, IT and AI are really the new assistant in medicine to give you that information. That is really fascinating. Excellent. All right, well, up next, we're going to take questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's continues to make sure patients always have access to leading medical technologies, no matter where they receive their St. Luke's care. St. Luke's recently cut the ribbon on a fleet of the most advanced ultrasound technologies from GE Healthcare, raising the bar of imaging and ultrasound to a level not seen in the U.S., creating consistency in radiology, vascular, and cardiology services throughout the network. The artificial intelligence built into the technology's software allows our radiologists to arrive at diagnoses earlier, to promote earlier treatment and better outcomes for our patients. Plus, St. Luke's relationship with GE Healthcare means these technologies will continue to perform with the newest software upgrades for years to come.
To have the highest quality of imaging, you really have to have consistency. There's not a single institution that has done this big of a replacement and investment in patient care with ultrasound. This upgrade brings cutting-edge technology and improved imaging quality to all of our exams.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about artificial intelligence at St. Luke's University Health Network. And now we have some questions from our viewers, from all of you. So, are you guys ready? Let's get started.
Let's do it.
All right, so Chad, I'm going to start with you. One viewer asks, is my data being collected without my knowledge to provide information in these algorithms?
As a patient, you consent for treatment of care. as when you come in, you sign documents to say you're allowing our physicians to take care of you. And during that, it's our physician's job to use the information to take care of that treatment. Whether that's information in the electronic medical record or AI, our physician's job is to interpret that information and to treat you, and you're consenting for that treatment.
Okay, so when you talk about the treatment options, I think that this is a good question for you, Charlie. This viewer writes, I've been diagnosed with cancer. How will AI and my data help with my prognosis and treatment plan?
So if you think about what we talked about, the EMR being a repository of a patient's data, so that patient's record is a repository of their history, of all the things that led up to that diagnosis. All of that data can be used in imaging studies to identify the cancer, to treat the cancer, to localize the surgical revision of a tumor, right? So we have robots that assist in that excision. That's all AI driven. When we think about the best care for our treatment, we think about what's the genetics behind that patient's cancer, and how do we use those genetics, i.e. using that data from that patient to optimize their treatment plan.
Really advances that truly help patient care and personalize medicine even further, which is pretty exciting. All right, Chad, I think this one is for you, and we've touched on it, but I do want to mention it again. This viewer asks, as much as I like accessing my medical records through my chart, I worry about security. How secure are my medical records and the software being used to monitor them?
Very secure. I think the most important part is we all follow in healthcare a set of security best practices, and St. Luke's follows those security best practices, and we are constantly innovating to make sure that we're staying up with those best practices.
Charlie, I want to ask you about St. Luke's and its progress in this field. Really, this concept has not been around for that long, but St. Luke's is an early adopter. Can you tell us about why they felt it was important to get in early with artificial intelligence?
In early 2018, we were really struggling with moving the mark on sepsis. And there was an algorithm that was available to us through our EMR vendor that we began to investigate. And that really led to our initial use of AI around a disease process. The success of that, and St. Luke's success with managing sepsis, we are meeting the mark not only in the state, but nationally. We're above the benchmark. We are top decile at sepsis care. And that really led us to continue to use AI as an assistive device to predict diseases, to treat diseases sooner, and really interact with patients who may have a complex process going on that we could stop and reverse before they would enter into the ICU and have a deterioration.
So seeing where AI could assist in one particular area like sepsis allowed the network to think, where else can this be useful? And Chad, I'll end with you by asking you, what does the future look like with St. Luke's commitment to artificial intelligence and to data management?
Well, St. Luke's has been a pioneer in artificial intelligence within the health community through our work with a lot of the stuff that Charlie has been speaking about today. The future, I think, is very bright. We're on the very, what I could say, early innings of artificial intelligence in healthcare, and as it begins to get smarter and learn more, the better I think it's going to be for our physicians and our patients.
Well, thank you both for being here. We really appreciate it. Excellent information. It's amazing to see how far artificial intelligence and the IT departments at St. Luke's have come in just a short period of time, and how much they impact all of our lives really daily. So thank you for being here.
Thank you.
Thank you.
For more information on artificial intelligence at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.